I'm Gerry Pollet, State Representative in the 46th District, which is all of northeast and much of North Seattle, from basically the UW all the way to the City Line and west to Aurora. And today we're going to be talking about the fentanyl epidemic and how it's affecting our children and what we can do to save their lives, as well as some other school safety issues. One of the most important and life-threatening issues facing our children is the opioid and fentanyl epidemic. We heard the most heart-wrenching testimony in the Education Committee from a mother whose son went to bed, had a joint. She went in the morning and he was dead. And we're seeing this over and over again. Youth who have no idea that their recreational drug use is putting their lives at risk because of fentanyl. And so what we're doing in conjunction with the pediatricians is we've proposed to ensure that every high school student and every college student has the opportunity to go into a school nurse's office or go to a vending machine on campus and, without any questions asked and no cost, take home an opioid fentanyl overdose reversal medication kit, which is a simple nasal spray called Narcan. 1 shot, 2 shots, and you can reverse and save someone's life. The pediatricians have documented that in King County, 2/3 roughly of all deaths from fentanyl under 18 occur at home and with someone else present. If that other child, a teenager, young adult, had naloxone, Narcan in the rec room, they could save the life of their friend or sibling. So that's what we're aiming to do. We have legislation that we're moving along. One, to do a education program in our public school system for the dangers and how to recognize the dangers of opioids, and continue this long haul, because today it's fentanyl, it may be something else tomorrow. And so we need to do a lot more education, and not just the old-fashioned don't do drugs stuff, but let's recognize, how do you know what the drugs are that you're taking and the harms, and how do you respond to them? Secondly, to do the same thing with a college program for education. So we've got 2 bills that are moving together, and then my budget proviso providing naloxone, Narcan for overdose prevention to fund being able to have that at home, in a dorm room, an apartment. The use of isolation and restraint is mostly aimed at children with disabilities, children on the autism spectrum, children who sadly can't control an outburst, and often their educators haven't been trained in what we call positive behavioral interventions, de-escalation, and how to ensure that someone does not trigger and disrupt the classroom, because we want those children in the general education classroom. And so in 2015, I sponsored legislation to bar the use of isolation restraint as a planned activity instead of working to make sure incidents don't happen. Because up to that time, many school districts actually had closets where they would lock children in, literally. And unfortunately, a few do. They've improved the rooms. They may have padding now. They may have an observation window, but it's still incredibly traumatic. And HB 1479 would phase out the use of planned isolation entirely, especially for pre-K to 5th graders. Doesn't mean that you can't restrain a child or a young adult, in the case of a high school student, who is a threat to themselves or someone else, we're very clear that you can. But you shouldn't be planning to do that instead of being trained how to ensure that they don't trigger in the first place. I'm very excited about the bill this year because it includes an extensive effort to develop far-ranging training from the paraeducator all the way to the school principal and even the school board. And we find that's really important because the first law we passed said you have to report incidents, but schools didn't take the next logical step and say, how do we prevent them from repeating, which we thought was a logical thing we wouldn't have to say. But a lot of them haven't done that. So we say you have to have a plan in place to prevent the repetition, and we're going to provide the training to go with that. Really scary issue of a child who goes to school and has a food allergy or other allergy, bee sting allergy, and may forget their epinephrine injector. This is really scary for parents and, of course, for kids. Look, I forget things every day. Well, expecting a child to remember to have that in their backpack or when they're on a field trip is really way too much. So we need to have epi injectors, and we're hearing from the school nurses and EMTs to have injectable epinephrine with a standing order that a nurse or someone else can administer it. Standing order means you don't need the prescription, so you can just have it there at the school and be trained to administer it. And the injection is much less expensive and easier to renew than the auto-injectors are. The child should have an auto-injector with them, but the school nurse can have an actual needle. I'm very hopeful that although there's a short 60-day legislative session, when we are done, we're going to have done a really good job of adding new tools to protect our children from drug overdoses, from especially the fentanyl epidemic, to protect children, especially those who are with disabilities, from being isolated and restrained and traumatized or even physically hurt, and to ensure that children with allergies have access to their life-saving medication, someone trained to give it to them. This will be a broad spectrum of improving school safety, and we will be addressing and continue to work on gun safety in terms of our schools as well this session, which we can't ever forget about. You can contact me, and I encourage you to email me about this or any other issue, and to ask if you can join me for one of my drop-in Saturday morning discussion times. And just email us and we'll send you a Zoom link or tell you if we're meeting at a coffee shop on a Saturday morning near you.